2006, you were what, about 8 or 9?
Yeah, I was
You were a
in
little
4th
recent.
grade, I think. Yeah.
Look at you now, you're huge.
Yeah, I've grown a little bit since then. The patients that Dr. Katelis treats are a lot of times going through really hard stuff. You like football? Yeah. Yeah, on the TV. You know, both physically and emotionally, being in the hospital for such long periods of time. Although I didn't go through the stuff that they're going through, I had a similar experience with the same doctor. So I felt like I could relate to them a little bit. Here you go.
What did you say?
Thank you.
Can you throw it to me? Oh, nice. Oh, that was a good spiral. That's better than I can do. You can catch it? Oh yeah, there it is. I was playing on the playground in 4th grade during recess, and I was playing catch with some of my friends. I threw the ball, no contact, no nothing, and I fractured my humerus.
So Matt was referred to me by another orthopedic surgeon. He presented to the other surgeon with a sore shoulder, and he did some x-rays and discovered a tumor of the upper end of the arm bone, the humerus. And knowing that I specialize in these tumors, he was sent to me to both diagnose and treat this condition. Fortunately, Matt's diagnosis was a benign bone tumor called a unicameral bone cyst. Now, while it's a benign tumor, it destroys a great deal of bone. And in his case, it was destroying 4 to 6 inches of the upper arm bone, which is why the bone is at such risk to break or fracture.
There were a few options that were given to me when I came into Rush and found out that I had a bone cyst. One of them was just let it heal normally, don't do anything to the cyst, but that would leave me at a higher risk to refracture it, and if I continued to refracture it, then I likely wouldn't be able to play contact sports for the rest of my life. And the other option there was getting surgery to remove the fluid from my humerus. I went with the latter. I went with the surgery because even though it was kind of a new surgery, like it hadn't been used too many times, so it was kind of risky. I thought that just having that security and not having to worry about a re-fracture every time I did anything was kind of worth it for me.
Treatment that was done for Matt for the benign bone tumor in his shoulder was kind of revolutionary at the time. Previous procedures that Matt might have had at other institutions would have had large incisions, possibly taking down some of the muscles that attach to the shoulder, whereas this procedure, like we said, was minimally invasive or percutaneous, done through a couple small poke holes. It really preserved all of the muscle attachments, and I think probably gave him a better functional outcome, certainly in the short term and probably in the long term too.
Looking back on the operation and the whole process and recovery, I'm super thankful to have worked with someone like Dr. Katelis and the whole Rush team. They made it super easy in a situation where if it went wrong, I might not have been able to play sports in high school, let alone, end up making it to the college and then eventually the professional level. I didn't have to go through things that a lot of kids that are Dr. Katelis' patients have to go through. But I think in the end, these experiences that may seem tough at the time, when you look back at them, it kind of makes you who you are and makes you stronger and makes you appreciate life and sports and your friends and competition so much more.
It's why I do what I do. It's very, very enjoyable to see the children that I treat, some with cancer, some without, grow up and become the adults that they are. Fortunately, in Matthew's case, he didn't have cancer, but still it posed some risk to his future. So to see him grow up to being, I think, 6'7", and more than 300 pounds, and a professional lineman in the NFL, is incredibly gratifying.
Hopefully they could see that there's a light at the end of the tunnel, and that what they're going through is really hard. Eventually they're going to get through it and they're going to be better for it.